This lecture will talk about viral infections. So we have a few that don't really fit in viral infections, but I don't have anywhere else to put them. So we'll talk a little bit about some rickettsial infections and parasitic infections, and then the majority of the talk will be on viral infections, those listed here, and we'll end up with a brief description of antiviral medications. So rickettsial disease. Most rickettsial are true bacteria, but they require living cells for growth. That's why they don't really fit great with the overall bacteria. So they don't fit in with this true bacteria. They're kind of their own category. They use an animal reservoir or an insect as the vector. So they need this animal. They're considered a zoonotic type of disease process. So RMSF is Rocky Mountain Spotted Fever. Many of you in this area have heard about this. This can be either a flea infestation or a tick bite. Patients will have an unexplained fever, headache. Headache really here is the key difference, and a rash may develop, and generally the patient lives near or is around a wooded area along with a fever. The diagnosis is made with serologic testing, and it's treated with antibiotics. The key thing to remember here is that the rash tends to be this kind of spotty area around the trunk. So here is, this picture doesn't look great now that I have it on full screen, but this truncal spotty rash is noted. And again, think of Rocky Mountain spotted fever. So a fever, the patient complains of a headache, and they have this rash around their trunk. Next one we'll talk about is parasitic disease. This is really kind of what we see on Discovery Television. It's pretty rare, but it's a rare infection from Africa where we get these weird worms that come out. They tend to be around water potentially, or also the nematodes are near the soil. And so they end up in the human intestines, where they have these hookworms or pinworms or tapeworms. They come about from improperly cooked pork, part of the reason it's pretty rare in the United States. And there are some treatments of antiparasitics. We don't see these very much. Again, they tend to be in lesser developed countries, or if there's been a major disaster where the water systems become contaminated. Okay, now to viral disease. This is the smallest of pathogen. It's smaller than a fungal unit, completely dependent on living cells to reproduce. They program with their RNA and DNA. They spread mainly through respiratory and enteric excretions. Some are zoonotic, like the West Nile virus, but most are spread through either a cough or a sneeze. Some are related to those patients that are receiving, that have cancer. So viral infections that we see frequently are the common cold, bronchiolitis or bronchitis. So if it becomes pneumonia, pneumonia is probably a bacteria. The common cold, again, is self-limiting. It goes away with no treatment, or whether we treat it or not, you're going to get better. There are some antibacterials antiviral medications. They just cost a lot, and we don't have very many of these medications, so we don't use them very often. So rhinovirus is the most common cause of the cold. This is where somebody has a snotty, runny nose. It's spread person to person. Patients will complain of itchy, watery eyes. Most treatment is supportive, something to take care of the fever, the sore throat. Nothing kills this virus. Patients get better on their own. So what about influenza? We screen for A and B on hospital admissions in those patients that we think may have this. The symptoms are kind of this fever, generalized aches, upper and lower respiratory infections. It can come secondary to a bacterial infections. It's diagnosed with serologic testing, and the prophylactic treatment is a vaccine. Again, the vaccine, we're not going to get sick from the vaccine because it is a dead vaccine. When we talk about a fever, it's generally a low-grade fever, kind of a body ache. We don't have this body ache in pneumonia, so the body ache is unique to the flu. The cough, it's like when you have a cold, it tends to be a more scratchy, kind of dry cough. There are several antiviral drugs that are generally saved for those patients that need them the most. This can be this is where another type of this is the Theraflu, is another antiviral drug. And these are given to people who test positive for influenza A or B, are given the antiviral drugs. So parainfluenza viruses, these are most common cause of croup or laryngeal tracheal bronchitis. Croup, again, is that real barky cough. It's more common in early childhood, in part because kids have a smaller airway than adults, and so that upper airway gets inflamed from this viral infection, and their airways, the swelling in their small airways is just much more prominent. Most kids will outgrow this. It kind of seems that once a kid is prone to getting croup, each time they get a cold, it may develop into croup. It's diagnosed with a nasal swab. Generally, the treatment is supportive, meaning cool mist. You often hear people saying that it also tends to be better in the morning and it gets worse as the day goes on, and it's worse at night. So they finally decide it gets bad enough at night. They take their kid out, and their kid's croupy and has a ton of stridor and this barky cough, and they take him out into the cold air to take him to the doctor. Once they get in the cold air, they breathe this cold air in, and they actually get a little bit better. And so by the time they get to the doctor's office, there's hardly any symptoms because they've exposed them to this cool mist. Not always, but so they'll do something where if you go out in the cold and breathe that cold air, it actually decreases some of that swelling. We may give a medication that decreases the swelling. The patient will be given oxygen if their airway's swollen enough that they're not getting enough oxygen in. Occasionally, racemic epinephrine or a bronchodilator is given. So the nasal swab, what we're looking for is serology. They're looking at an antigen antibody test. We often don't diagnose it actually with the test because we don't treat it any different because it's primarily a supportive treatment. Adenoviruses is a group of many viruses. These are all upper. It's both upper and lower respiratory tract infections. So respiratory syncytial virus is a seasonal virus that comes around that causes bronchiolitis, more common in the winter and in early spring. It generally affects infants age 1 to 6 months, so really small newborns. they do wind up in the hospital, and in the winter and early spring months, the pediatric wards will have what they kind of call RSV season, where they have multiple kids admitted for this virus. They have cold-like symptoms in adults. It causes cold-like symptoms in adults, but in children it's causes a lot of consolidation in their lungs. They have cold and flu-like symptoms, difficulty oxygenating and breathing. Rubeola causes the measles, also known as rubeola. These patients will be in airborne precautions. This is a respiratory infection or respiratory spread disease from secretions or cough. It's highly contagious. About 90% of the people without immunity sharing a house will become infected and catch it. That's how easily it spreads. We've all been vaccinated for this for the most part. If we were vaccinated, we have been vaccinated against this, and so we don't see this disease very much. Herpes simplex virus this may cause oral or genital lesions. Herpes simplex virus is generally contacted by direct contact of lips or genitalia when the sores are present or when viral shedding is occurring when no spores are present. It's also present in seminal and vaginal fluids and saliva. So it's kind of like the cold, where if you have symptoms, before the symptoms have occurred, you've been transmitting the disease to others. So type 1 herpes simplex is the canker sore, cold sore, fever blister type of herpes simplex. Type 2 is what we refer to for the genitalias. The reason the time that this can be dangerous then is in infants, the target organism is the brain, and if a mother has type 2 herpes simplex, and as the child passes through the vaginal canal, they can become infected, and they don't have a defense mechanism to defend themselves against this virus, and it can cause brain damage. So in these patients, that a C-section will be provided so the infant doesn't pass through the vaginal canal where they would be exposed to that. Herpes zoster is shingles. It's a reactivation of the chickenpox virus, and it leads to a painful kind of blisters in the skin. They tend to be more prevalent in the truncal areas. They live in the nerve cells, and if somebody gets sick or is really stressed, they come back to bother people. Varicella zoster is again viral shedding from the respiratory or bowel. This is again the virus that causes the chicken pox, and these patients will be in airborne isolation. Cytomegalovirus. In some of you we carry this. In most of us it's not harmful. It can become harmful if you're pregnant or in those patients that work in a daycare setting, because it will target the brain and cause meningitis. Severe acute respiratory syndrome, or SARS. This was big about 4 to 6 years ago-ish. It was first detected in China in the late 2000s. It appeared to be some sort of new strain of virus, and again spread through respiratory droplets. It seemed to affect mainly young and middle-aged adults, which was kind of why it was so scary. Most things affect older adults without a healthy immune system. This was affecting those with a healthy immune system. It was just an organism the body had not seen before, and they became sick. Older people seem to be protected, and they think to some degree older people had been exposed to some of this strain, that they had actually built up some immunity to this organism, whereas young and middle-aged people hadn't. So some antiviral medications. The ones we see is acyclovir. It's in the herpes family. This is given to patients with real bad shingles. Amiantamidine or rhinamantidine can be used to prevent the flu. AZT is used in HIV patients, and ganciclovir is a newer medication that is used to treat organisms in the herpes family. We used to give patients with RSV more frequently pentamidine, and however it's not curative. It just put it into remission, and so pentamidine was a really expensive medication to give, so we don't see that given as much anymore. We kind of save money and let the body take care of it, and we do more supportive treatments. So there's your list of antiviral medications.